Currently, over 235 individuals in Minnesota have tested positive for the novel coronavirus, also known as COVID-19. These numbers are still expected to rise. Everyone is encouraged to stay home and follow social distancing. It is possible that you may have COVID-19 without having or exhibiting symptoms. It's possible you may only have mild symptoms and could pass it along to others who may become seriously ill. This includes older people and people who may have underlying health conditions who are most at risk for COVID-19. It is incredibly important that we all work together and do what we can to slow the spread of COVID-19. This means that we must protect ourselves. Here are some possible ways we can do that. Please wash your hands often. Wash your hands often with soap and water for a minimum of 20 seconds, especially after you have been in a public space, after blowing your nose, coughing, or sneezing. If soap and water are not readily available, you could use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. It is important that you avoid touching your eyes, your nose, your mouth with your unwashed hands. Second, it is important to avoid close contact. Avoid close contact with people who are sick and put a distance between yourself and other people if COVID-19 is spreading within your community. This is especially important for people who are at a higher risk of getting very, very sick. It is also important at this time that we are protecting others. An example of this is staying home if you yourself are sick unless you need medical treatment. DHH, in a partnership with the Fairview Hospitals, will be releasing a separate video. This video includes information about what to do if you need to go to a hospital or a clinic. Information changes every day, and sometimes it can change incredibly fast. There is also a lot of incorrect information being shared as well. Here are some of the places where you can find the most reliable information. The Minnesota Department of Health, or MDH. MDH has a webpage dedicated to COVID-19. They have also established a hotline that you could call through your phone. This includes access through video phone, caption phone, and TTY to ask questions. MDH created a PSA done through an ASL video. DHH also created a deaf-blind friendly version of the video as well. Another resource is the Center for Disease Control and Prevention, the CDC. Similar to MDH, CDC has a webpage dedicated to information about COVID-19. They also have a link where you could subscribe to get all of their email updates. On their website, you will find content that also includes an ASL version. All of their videos have been captioned as well. The Office of Governor Tim Walz and Lieutenant Governor Peggy Flanagan is another resource. They have been providing regular news conferences. The governor's office has been working hard to make sure their updates are accessible for people who are deaf, deafblind, and hard of hearing. There are some logistical challenges, but here are some of the things that they have been doing. They are making sure that they are using a space that allows everyone in the room to be following the practice of social distancing. They have been providing an ASL interpreter as well as a CDI or qualified deaf interpreter. They have been using CART or captioning technology and have been sharing their videos through multiple platforms, including Facebook Live and the local news channels. In some of these instances, streaming could be blurry. Maybe captioning is not available, or the camera person zooms past the interpreter or too close to the interpreter. This means there are still some kinks that need to be worked out. MNC DHH is pleased that many news organizations are including the ASL interpreter in their news gatherings. Please, you are encouraged to follow your local news station. If they include ASL interpreters and captions, take the time to thank them and also encourage them to continue to use these vital resources. If they do not include ASL interpreters or captioning, please contact them and ask them to do so. MNC DHH has a page for our media partners related to accessible media reporting. On this page, you can share that with the local news stations. There are some other places where you can gather information, but as a state entity, MNC DHH cannot endorse information that is not from MDH or the CDC. However, we are aware that there are other organizations sharing accessible information. Both the National Association for the Deaf as well as Communication Services for the Deaf. They both have a COVID-19 resource page on their organization's website. Other resources include the Daily Moth, DPAN TV, Sign One News, and other ASL news reporters are also covering this topic. Check out those resources and also follow the daily updates that are shared from MDH and the CDC. Watch for scams. COVID-19 is an opportunity for scammers, but please be careful. If you are inclined to donate, please only donate to organizations that you know well and trust. There are some scammers who will try to sell products that prevent or cure COVID-19 or the coronavirus. But understand, still the best way to protect yourself is to wash your hands and maintain a social distance. Currently, there is no cure. We only have the option to treat the symptoms. You're encouraged to visit the Office of Attorney General Keith Ellison's website in an effort to learn more.